The purpose of this project is to create a disaster preparedness plan that illustrates the importance of a shelter in place during a hurricane on communities and vulnerable populations. This project will assess what is necessary to run a successful shelter and will outline the location, the interprofessional team, the triage process, and discharge considerations. A short-term shelter is an existing facility or facilities, such as a school, community center, convention center, or church, temporarily converted to provide safe, accessible, and secure short-term housing for disaster survivors. When allocating space in the shelter, there are multiple things that need to be considered. There should be ample parking space with handicap accessibility, and there should be a drop-off area with plenty of cleared space for emergency vehicles. In addition, there should be a waiting area, a registration area, a children and family area, a dormitory area, feeding and food preparation area, an area for health services and mental health services, a lounge and/or recreation area, storage areas, shelter management offices, and a separate staff area. Since a majority of the time the people spend in the shelter will be in the dormitory area, it is important to allocate separate spaces for individuals, such as families with children, single women, single men, and others with cultural and religious preferences. It is recommended that 40 square feet of space be allocated per resident in a dormitory area. Individuals using mobility devices or other assistive support may require between 80 and 100 square feet. It is important to remember that often during hurricanes, the shelter may have to accommodate greater numbers of people initially. Residents may be placed in confined areas with less than 20 square feet per person until the storm is over. It is important to ensure that the building is compliant with the Americans with Disabilities Act, allowing access and movement through the building to all individuals. Logistics include the acquisition and maintenance of materials, equipment, and services necessary for shelter operations. It is important to identify and locate resources such as potable water, communications equipment to include phones and computers, food and food service supplies and equipment, sanitation supplies and equipment, children and infant supplies, universal accessible cots, blankets, pillows, personal hygiene supplies, towels, durable medical equipment to include wheelchairs, oxygen concentrators, first aid supplies and medications, administrative supplies, and tables and chairs. Important maintenance and custodial services that may be needed include janitorial and cleaning services, waste removal services, grounds and parking lot cleaning, maintenance and/or repair of heating, ventilation, and air conditioning, plumbing, and electrical facilities, extra cleaning and sanitation supplies. It is important to arrange and contract for services if needed using resources from your supporting agency or the local EOC. Ventilation for a shelter should comply with the building code or ordinances adopted by the local jurisdiction. Providing safe drinking water in hurricane shelters is especially important because of the potentially long duration of occupancy. There are specific requirements for potable water supply and wastewater storage for hurricane storm shelters designed to accommodate more than 50 occupants, though as a best practice, potable water should be provided in all safe rooms. In addition, the local building code may require standby power for both lighting and ventilation. Since provision of standby power is particularly important in hospitals and other residential care facilities, it is required to have standby power for life safety systems. Emergency generators, along with their fuel tanks and associated connections, should be protected with an enclosure designed to the same criteria as the shelter. To ensure a safe and healthy shelter environment, an inspection of the facility prior to opening should be completed and the following considered. The facility should be in a safe location near the affected area. It should be clean and orderly. The kitchen and bathroom should be functional and sanitary. There should be sufficient lighting in public areas. The indoor and outdoor walkways should be open and free from any hazards. The emergency exits should be clearly identified and unobstructed. The facility should be accessible to children and adults who may use mobility devices such as wheelchairs or canes. The first aid kits should be readily available and fully stocked and their location known by all staff. In addition, the shelter should comply with local fire regulations. To ensure this, inspection assistance should be requested from the local fire department. The shelter should be inspected for fire safety, and the following factors should be considered. Check general condition of sprinkler systems if present. Check for fire extinguishers, note the locations, and share with staff. Check emergency exits and ensure the fire doors and exits are in good working order and accessible. Check for potential hazards, fire or electrical hazards, and develop a fire evacuation plan and conduct fire drill if needed. Include notifications and evacuation requirements for residents and workers with access and functional needs. It is important for the shelter management team to be realistic about the security risks that may exist in a large emergency shelter and to constantly monitor for signs of developing situations. The following factors should be considered when assessing and planning for security. The demographics and number of residents, including older adults, individuals with disabilities, and children. The physical layout of the shelter facility and how this may affect shelter security, such as lighting or isolated rooms and areas. You should coordinate with your local EOC about security needs, communicate with law enforcement, share the security plan with staff, and consider contracting security services as a last resort. Special security measures that may need to be instituted based on the situation include the following: issuing shelter identification, such as wristbands and cards, to shelter residents and staff, performing identification checks at all doors, limiting the number of public entrances and exits, posting personnel to monitor the doors to the dormitory and children's recreation area, searching packages at the door, monitoring bathrooms, establishing off-limits areas, and instituting external patrols of the immediate area around the shelter, including parking areas, and finally, relocating problem residents. One of the greatest challenges in operating a shelter is recruiting and maintaining adequate staff. Every shelter needs a shelter manager who is qualified to provide support and supervision of all functions to ensure that residents' needs are met. It is important to delegate tasks to competent subordinates in order for the shelter to run smoothly. The shelter manager should conduct daily staff meetings to ensure that information is shared among all staff and volunteers working in the shelter. In addition, the manager should brief staff on how to work with the media and how to handle media questions and interviews, and remind staff of the procedures for handling donations of monetary and material goods. There are multiple roles that a nurse can play in a shelter, such as nurse manager, charge nurse, staff nurse, and care assistant. The role of the nurse manager includes providing supervision for the nursing and public health staff, overseeing the medical aspects of the shelter, selecting patient triage and care areas, and communicating with the Emergency Operations Center. The charge nurse reports to the nurse manager, supervises triage and assessment, monitors the conditions of patients and transfers as needed, and assigns and supervises all staff related to the medical management of the shelter. The staff nurse reports to the charge nurse and delivers appropriate nursing services within the medical needs shelter and assists the charge nurse as needed. His or her responsibilities include performing triage and nursing assessment on individuals presenting at the medical needs shelter, referring individuals who do not meet the medical needs criteria to the mass care shelter or other facility with assistance from the service worker, assessing the physical condition of patients at least every 2 to 3 hours, assisting caregivers and delivering services to patients, assist with the collection of medical data pertaining to patients, assist with the discharge process, general stand down of the shelter. Common conditions that a nurse might encounter in a hurricane shelter include diabetes, patients with respiratory issues, patients requiring tube changes, and patients requiring simple dressings. Social workers can offer a variety of mental health services in the immediate aftermath of disasters. Some of their critical and immediate intervention skills include psychological first aid, family care, mental health media communications, and resilient community capacity building. Psychological first aid assists those in crisis in the aftermath of disaster. It relieves initial distress in an effort to promote short and long-term coping. This sometimes includes crisis intervention and counseling. Family social workers help families during crisis. They aid survivors in locating the services they need to overcome post-disaster challenges and repair their lives. Mental health media communications. This field provides voices and vital points of view for underrepresented or disadvantaged populations. And finally, resilient community capacity building includes creating response plans for various groups. When social workers assist in disaster relief programs, their roles include case management, case finding, outreach, advocacy, and brokering. Case management includes locating appropriate resources for clients, making sure they receive the services they most require. Case finding involves providing survivors with information about the programs available to them. Outreach increases program locations in order to allow services to be more accessible. Through advocacy, they use connections with various relief organizations and they advocate on behalf of clients to qualify them for additional services. And finally, when acting as a broker, social workers link client systems to the resources they need, fulfilling client needs throughout a multiplicity of programs. The American Red Cross plays a vital role in the establishment of safe shelters during disasters. They stock supplies in preparation for hurricane victims. They provide shelter and food until families can return home. They provide water, emergency supplies, medical care, and give guidance, hope, and comfort to the community. In addition, they provide cleanup supplies, assess damage in impacted neighborhoods, and work with families in developing recovery plans. After a disaster, the Red Cross works with community partners to provide hot meals, snacks, and water served as shelters or from Red Cross emergency response vehicles in affected neighborhoods. They provide people in shelters with comfort kits, which contain basic personal supplies needed in the aftermath of a disaster, such as toothbrushes, deodorant, and shampoo. Other emergency supplies include tarps, rakes, shovels, and trash bags. Red Cross health volunteers travel to disaster sites to help people cope. Health workers can provide first aid treatment for injuries, monitor the well-being of people staying in the shelters, and replace prescription and medications or eyeglasses. In addition, Red Cross mental health workers specialize in providing emotional support and help people cope after a disaster. The American Red Cross also provides disaster spiritual care community outreach, or DSC. DSC provides faith-based groups with information, support, and if necessary, coordination for community memorial services. DSC liaisons with local faith communities to aid in recovery and resilience. You must be an endorsed professional chaplain, a board-certified chaplain, an endorsed leader of a faith community, or a spiritual care volunteer approved by the National VOAD. There are several other organizations and groups that respond to the spiritual needs of people that have been affected by natural disasters, such as the PDA, which is the Presbyterian Church's United States of America Emergency and Refugee Program. They provide emotional and spiritual care, as well as long-term recovery assistance to communities affected by natural and man-made disaster. Each year, the 100 volunteers on the PDA's National Response Team deploy about 60 times. Another organization that helps victims of natural disasters is the Salvation Army. The Salvation Army understands that in times of physical need, such as food, shelter, and water, there are also emotional and spiritual needs. The Salvation Army deploys trained staff and volunteers to meet the needs of the whole person. Detailed and accurate registration and triage data is necessary to ensure the health and safety of individuals staying in a shelter. Some things to consider when creating the registration area include that the registration area should be clearly labeled, easily accessible, and near the facility's main entrance. There should be restrooms and fresh water nearby and chairs for those who can't stand. It is important to allow enough space between registration tables for privacy when clients are providing registration information. When triaging families, the following information is important to obtain. You can use one form, card, or sheet of paper for each household to record the family name, the total number of family members, the pre-disaster address, phone numbers and email addresses, method of transportation to the shelter, the primary language, and the names of family members who speak English. Initial health and mental health screening should be conducted with each family member by asking if they are ill or injured, require medication, have dietary restrictions, have mobility or accessibility concerns or functional support requirements, have missing or deceased family members due to this disaster. Individuals should be referred to health services and mental health services staff as appropriate. When unaccompanied minors are identified, notify local law enforcement immediately. Designate a member of the shelter staff to accompany the minor until custody can be transferred to the appropriate authorities. It is important to remember to allocate separate spaces for families, single women, and single men, and the shelter should be prepared to make accommodations for religious and cultural requirements. Some other important things to consider when assigning placement of individuals within the shelter include those with physical and functional disabilities. For example, people with supervision needs may include children and adults with cognitive, intellectual, and mental health disabilities. These individuals should be placed closer to staff areas to ensure they are properly cared for. People with visual disturbances may need sleeping space located along a wall or in a corner to make it easier to find. People with mobility issues should be assigned cot space in an area where access to dining and restroom areas is easily available and not obstructed. Persons with service animals are entitled to keep the service animal with them at the shelter and in any convenience at all times. By law, service animals must remain with the person they serve. This includes accompanying an individual anywhere within the shelter. Consider providing alternate accommodation to any residents who express concerns regarding allergies to animals. One of the first steps to triaging patients is determining whether the shelter can provide the assistance and support needed or if they need to be transported to a higher level of care. This can be accomplished by looking at vital signs, disposition, whether they manage their health needs at home, if their caregiver is present, their medical history, and any medications they are taking. It is also important to consider the experience of the medical providers, the resources available in the event of a medical emergency, and whether or not transfer to definitive care is possible. Before closing a shelter, several important items should be considered. With your supporting agency or the local EOC, determine the following: how to meet the needs of the remaining shelter residents, if there is a plan for combining multiple shelters to minimize the number of open shelters, if other housing options are available for shelter residents, the facility's ongoing availability, requirements under the facility shelter agreement or lease. In most states, there is a multi-agency shelter transition task force. The task force includes the Department of Social Services, the Department of Aging, Department of Health and Human Services, County Social Services, the County Housing Authority, and Voluntary Agency Liaison. Private organizations within the task force include Catholic Charities, Crisis Counseling and Mental Health, the American Red Cross, local faith-based organizations, local homeless coalition, legal aid, the Salvation Army, Habitat for Humanity, and federal agencies such as FEMA, HUD, and SUDA. The conduction of case management should be consistent with the established disaster case management principles that include the following stages. Phase 1, planning, where they gather the following information from clients to match the need with agency organizations capable of providing needed resources. Phase 2 is coordination. The task force will collaborate to identify and provide a wide range of services to include casework, case management, housing resources, resource management, and program facilitation. The primary system utilized for case management coordination is the American Red Cross Network, also known as CAN. Phase 3 is implementation. It is recommended that a minimum of 3 field teams consisting of 3 to 4 individuals each be established to conduct site visits and interviews with survivors. Depending on the projected number of field interviews and or date for completion of the casework process under the task force, the number of teams can be adjusted. The process of shelter transition depends upon the availability of services to meet the specific needs of the shelter residents. These These services include immediate sheltering, disaster casework, disaster case management, social and support services, short term housing, transportation services, children's services, and financial assistance. Additional services include area agencies on aging and services, functional and access needs and/or disability services, feeding assistance, unmet needs, document retrieval, protection and advocacy, information sharing, veteran services, and pet and animal services.